Authorities in the Netherlands are sounding the alarm over the growing circulation of counterfeit painkillers after a 30-year-old man in Amsterdam lost his life to a deadly synthetic opioid. The victim had purchased what he believed to be oxycodone online, but instead, the pills contain nitazenes, a dangerous class of synthetic opioids far more potent than oxycodone, morphine, or even fentanyl. The risks associated with these drugs are severe, as even a tiny amount can cause fatal breathing problems, and their extended duration in the body significantly increases the likelihood of overdose. The case is not an isolated incident. Dutch health officials report a rising number of emergency medical cases linked to fake oxycodone, warning that these counterfeit pills are widely available on social media and illicit websites. The problem is exacerbated by the deceptive appearance of these drugs, which are designed to look identical to legitimate prescription medication, even coming in seemingly authentic packaging. This makes it nearly impossible for users to distinguish real painkillers from lethal counterfeits, putting unsuspecting buyers in grave danger. The Netherlands, like much of Europe, is facing an alarming rise in synthetic opioid-related incidents, with experts identifying nitazenes as a significant emerging threat. Unlike prescription opioids, which are at least regulated in terms of dosage and composition, these counterfeit pills contain unknown substances, mixed in unknown quantities, making them unpredictably hazardous. The potency of nitazenes means that a single pill could be enough to cause a fatal overdose, even in individuals who have previously used opioids. Health officials are urging the public to avoid purchasing painkillers from unverified sources, emphasizing that no one can truly know what they are ingesting when buying prescription drugs online. The illusion of legitimacy provided by well-crafted packaging and professional-looking websites is nothing more than a dangerous trap, luring people into a potentially deadly mistake. The Dutch Health and Youth Care Inspectorate has reinforced the message that prescription drugs should only be obtained through licensed pharmacies and medical professionals. Law enforcement is still investigating the source of the counterfeit drugs involved in the Amsterdam fatality, but the broader issue remains deeply concerning. The accessibility of synthetic opioids through online platforms means that more unsuspecting individuals could fall victim to these lethal substances. The European Union Drugs Agency has flagged the increased availability of synthetic opioids as a pressing concern, raising fears that more lives will be lost if action is not taken. Trimbos Institute, a leading Dutch research organization, has issued a strong warning, advising people who experience unusual symptoms after taking oxycodone to seek emergency medical assistance immediately. The unpredictability of nitazenes means that every exposure carries an extreme risk, and waiting too long for help could prove fatal. Meanwhile, authorities are calling on the public to report illegal online drug sales to help curb the spread of counterfeit medications before more lives are lost. The crisis highlights the dangers of attempting to bypass the healthcare system for pain management. Whether driven by cost, convenience, or the stigma surrounding opioid prescriptions, individuals seeking medication outside legal channels are exposing themselves to a deadly game of chance. The safest course of action remains the simplest. When it comes to prescription drugs, only trust a doctor and a licensed pharmacy. Anything else could be a fatal mistake.